day.
The Uplift. Stream on the free CBS News app.
All right, so it's time for our weekly segment with Dr. David Agus. He's ready to answer all of your questions about COVID-19, and we got a bunch, Doctor. Thanks for joining us. Let us start with this week. FDA advisors recommended updating booster shots to better match the most recent virus variants. This person is wondering if their family should wait to get the updated booster or get it right now, because I think, there has been some talk of a possible surge in the fall.
Right. And the question is, should you get that shot
now or wait closer to the fall?
Right.
Yeah.
It really depends on when your last shot was. If it's a long period, more than 6 months since your last shot, get the booster shot now. There will be new boosters in the fall, probably in October. Again, October, which is a lot of months away, and they'll be broader. They'll include Omicron, hopefully BA4 and BA5, which is now more than 50% of cases in the United States, which will give us a much broader immune response and more protection to the virus as it is now.
All right. This question is about the Novavax COVID vaccine and whether or not you feel comfortable recommending it.
Comfortable. It's such a funny word. I don't know how to respond to that. But what I will tell you is Novavax on paper was an excellent vaccine. The problem is their execution has been remarkably poor, and it has yet to be FDA approved. And their plant, which is where it's made, has had significant issues in manufacturing. So it's really hard to comment until we have all of the data, and we know they can make it and it's safe. But in concept, it's a good vaccine, but it's got a ways to go.
Our next question comes from a husband and wife who got COVID 5 days apart. They're quarantining together, but they want to know if there's a chance of reinfection. I guess if they could reinfect each other, and should they maybe separate until they're feeling better?
It's a great question, and I get it all the time. And obviously, it affects relationships, it affects family dynamics, and all kinds of things like that. If both of you got COVID-19 and one is obviously staggered a little bit later than another, it's okay to be together. You're not going to get it again, the exact same strain, and you will have immunity by your own immune system recovering. So they can stay together, assuming they want to, in the same house, in the same place.
All right. The next question is over whether or not it is safe to have an indoor party with 125 guests, and most of the guests are over the age of 70.
Wait, aren't you going to an indoor party over the
It's not
weekend?
my question, but it just so happens that I am going to a wedding this weekend in Chicago that is mostly indoors. My wife and I plan on wearing N95 masks, which we always do whenever we're anywhere besides outdoors. But Dr. Agus, what do you say?
Vlad, I noticed this trend where you say it's not my question, but it applies to me over and over and over again. And we got to.
You know why, Doctor? Because I'm every man. I'm every man, every woman. I'm like the classic American, so I represent the people.
All right, so Mr. Average Joe Vlad.
That's right.
Yeah, it certainly does seem a warning sign to me. People over 70, that means you're high risk for complications. An indoor party, especially in the summer, doesn't make a lot of sense to me, and it does scare me. Should you abstain from doing it? No. I mean, it's your own risk assessment. If you're willing to take some risk and do what you do and your wife does, which is wear a mask, which I think is awesome, in this setting, then you probably can do it. But you got to really be careful. Long interactions at close distances with people, even with a mask, can lead to COVID-19. Vlad, you're young, you're 25, so I don't think it's going to be a major issue for you, but people over 70, it is more of an issue.
Okay, so this question comes from a person who is 6 months pregnant. She is vaccinated, she is boosted, but she wants to know if she should get another booster.
So right now, the second booster is restricted for people over the age of 55 in the United States. There are conditions like pregnancy where you could say, hey, listen, it's a higher risk condition. We need to give that baby, when it's born, immunity. So getting a booster can make sense. So it's something to talk to your obstetrician about. But if it's been a long time since your last booster and you're in an area where there's higher risk, I do think it may make some sense.
All right. And let's wrap with a question about monkeypox. Should we be lining up to get the vaccine? Who should consider getting it? I mean, there's a lot of questions, Dr. Agus. I mean, how is it transmitted and who's at risk?
All right, so if you're born before 1973 in the United States, most likely you got a smallpox vaccine, so you're protected from monkeypox. So it's younger individuals. And what we're seeing now is that almost all of the transmission is male-to-male sexual partners. And so if you're in an area where there is significant monkeypox and you are having male-to-male sex, then you probably want to get that vaccine if it's available. And there's been some shortage of supplies in some areas, but certainly sign up to get that. But for most of the country, it's not a major risk at the present time. The government hasn't been great about rolling out the testing and the vaccines. I hope they get better, and we have a cogent national strategy with how to detect and to stop this outbreak.
All right, Dr. David Agus, thank you very much as always, my friend. We appreciate it.
Talk to you soon.
If you have questions about COVID-19, send them to Dr. Agus. You can tweet him at Dr. Agus, or you can text him at 310-299-9322. We're going to have Dr. Agus on